Hello, my name is Nina Avatabile and I'm making a mini podcast series on behalf of the Eating Behaviour Research Group. I'm joined by Lizzie Martin, who is in her second year of her PhD at University of Birmingham, and you also did your undergrad here.
Yes, that's right.
It's all in straight psychology.
Psychology and psychological research. Yeah, I did an MSci.
You did an MSci, so that's 4 years, and then now you're on to your 4-year PhD.
Yeah.
Perfect. So we're going to talk a little bit about eating behaviour and what you're doing for your PhD. So could you tell us a little bit about it?
So my PhD generally is looking at disordered eating in ADHD. There's an increased risk of disordered eating developing in ADHD.
And just disordered eating, that could be eating more or eating less, or both?
The strongest effects are in binge and disinhibited eating.
Okay, so more likely to put on weight if they have ADHD.
Yeah.
Perfect. And introception, did you want to cover a little bit about that?
Yeah, so one of the things that we think might link ADHD to disordered eating is a process called introception. Introception is the process of recognising internal cues, so that can be things like your heartbeat, your breathing, and your hunger and your fullness, and it's the hunger and fullness that we think might affect eating behaviour.
I then asked Lizzie about her upcoming study that she'll be conducting alongside Elizabeth Schneider, another PhD student from the Eating Behaviour Lab. This study concerns a drug which is currently being used for ADHD.
So we're using a drug called lisdexamphetamine dimesylate, which was initially made to treat ADHD, but after that was approved to treat binge eating disorder. And so it gives us quite a nice insight into possible mechanisms that are common to both binge eating and ADHD. So when we administer the drug, we expect to see improvements in binge eating and improvements in ADHD symptoms, and we're looking to see if the improvements in binge eating symptoms are dependent on improvements in ADHD symptoms.
Well, how will you measure binge eating?
So we will have a trait measure of binge eating, which will just be a questionnaire measure, but we'll also get people to eat on the UEM so we can see kind of what their eating's like, their eating rate, if they eat a lot.
Stuff like that, perfect. The UEM stands for Universal Eating Monitor. This apparatus is used to measure eating behaviour and consists of a set of hidden scales that is attached to a computer monitor. It can record a variety of measures, including how much people have consumed, the rate of consumption, information about mouthful size, and even information about how hungry or full an individual is during an eating episode. I then asked Lizzie to explain her main PhD thesis.
So, attention deficit hyperactivity disorder, ADHD, is a common condition. It affects both adults and children, and most people have probably heard of it. But what's lesser known is that 1 in 10 people with ADHD will develop disordered eating. The mechanisms that link disordered eating to ADHD aren't yet known. So what my PhD aims to do is to look at the neurocognitive factors that are common to both ADHD and disordered eating to try and understand why ADHD is associated with an increased risk of developing disordered eating. One thing that has been associated with disordered eating behaviour for a while is something called introception, which I spoke about earlier. It refers to sensing the internal state of the body, and deficits in this process have been seen to underlie disordered eating. Introception and kind of listening to the signals that are happening inside your body requires conscious attention, and given that inattention is a core symptom of ADHD, it's possible that the inattentive symptoms of ADHD can extend towards inattention towards internal cues. And when this is applied to eating relevant cues such as hunger and satiety, this can contribute to disordered eating. For example, if you imagine that you had poor processing of feeling full, you can imagine how that would underlie a likelihood that you were going to binge eat and overeat. So my PhD will largely focus around whether inaccurate introception in ADHD contributes towards the increased risk of developing disordered eating.
Sounds fascinating.
Yeah, it is. So what I've done first is complete a systematic review of the literature just to confirm that introceptive deficits are consistently associated with disordered eating. And then a main project will be using a range of methods, including neuroimaging, self-report methods and behavioural methods, and we'll measure introception using these methods to see if people with high ADHD symptoms show deficits in introception.
That sounds so. Just with the neuroimaging, just in case any listeners don't know what it is. So this is like an MRI scan, or what type will you do?
Yeah, it'll be functional MRI.
Yeah.
So it'll be looking at blood oxygenation levels.
Yeah.
Yep, to see brain activity. And what we'll basically do is ask people to attend to signals in their stomach or their bladder or their heart, which will be interoceptive trials, and then we'll also have exteroceptive trials, so we can compare those. So it'll be thinking of things outside
of the body.
Yeah, so we'll be able to contrast those and see processing specifically related to interoception.
In all different areas of the brain.
Yeah, the main brain region that is associated with interoception is the insula, so that'll be one of our main regions of interest.
To look at. Perfect.
Yeah. So the final big project, like we talked about earlier, is the one using lisdexamphetamine dimesylate. So it is. I'll call it LDX from now on. So yeah, it was initially made to treat ADHD, but subsequently it was approved to treat binge eating disorder. So we'll give the drugs to people with high binge eating symptoms. And because it is used to treat ADHD and binge eating, we expect to see improvements in both ADHD symptoms and binge eating symptoms.
So you're not just hiring people with ADHD, you're hiring non-ADHD people and then seeing the effects?
Yeah, just binge eating. Because ADHD symptoms can kind of be looked at on a continuum and they can be assessed quite nicely behaviourally. Tasks like impulsivity tasks and attention tasks.
Eating, doesn't it?
Yeah. So yeah, we expect to see improvements in the symptoms of binge eating and ADHD. And like I said, we'll look at whether changes in ADHD symptoms kind of influence changes in eating behaviour.
To see if it has a real life application.
Yeah,
to see if it make a difference.
Yeah, exactly. So, and leading on from that, what kind of overall the research might be able to do is kind of give us an area that we can focus on if we're looking to try and decrease the likelihood of disordered eating developing in ADHD.
So would it be more like if you saw someone potentially having disordered eating, you would give them this drug, or would it be more like you see what the drug does to the brain and then see other therapies that could replicate? What do you think? Or maybe both?
Well, because it's already used to treat ADHD and binge eating, but it's more kind of looking at the processes maybe that it affects that lead to those changes.
So looking at the why it's happening.
Yeah. And so things like introception, if we find that introception does play a role in disordered eating and ADHD, introception is something that can quite easily be kind of trained almost in people. If you kind of say to people, okay, focus on the signals coming from your stomach, use those signals.
So maybe almost like mindfulness type.
Yeah, and kind of intuitive eating type stuff.
Listening to your body.
Yeah.
And was the definition of introception difficult when you were doing your systematic review? Did it change, or was it different in different articles? Or
yeah, it's interesting actually because you think about internal signals, and you can think of kind of ones like I mentioned earlier, like heartbeat and breathing stuff and stomach stuff, kind of more from organs. But also things like soft touch have been included in definitions of introception. Pain.
Seems like a whole nother...
Yeah, it seems like it comes from kind of external stimuli, so how is it introception? But it does come under the same umbrella when you look at the pathways.
Yeah. What about temperature? I feel it in this room, so I'm like, is that an example?
Temperature is another, introceptive.
Oh, okay.
process.
So maybe teaching people to sense different temperatures of their body could help with disordered eating, maybe? Potentially.
That's something that we don't really know enough about to kind of say whether the different modalities of introception can overlap like that. They do seem to. In the systematic review so far, we have seen that kind of it seems a range of modalities are affected, not just the ones you'd expect in disordered eating, like hunger and fullness.
Yeah,
but
all of them. Wow. And also, just quickly before the end, I just was wondering how you got into eating behaviour, why you think it's interesting or important.
So eating behaviour I always found really interesting because eating is just something you do every day. You don't really ever think about why you're doing it.
Yeah, just ever since you were a kid, shoved it in.
And I think it's one of those things, sometimes you just step back and you think, oh, there is a reason I'm doing all this stuff. Link it to introspection, actually, you realise that you don't actually just eat because you're hungry or because you're full. There's all sorts of different things involved in that. And I wanted to look at what was going on in the brain that made that happen.
Yeah, very interesting. Perfect. Well, thank you so much for your time.
Thank you for having me.